serious it is and whether there could be a link to any of those scary news stories.
Hello.
We've come for a checkup with consultant dermatologist Dr. Madan.
How are you?
Yeah, very good, thank you.
Take a seat, please. Right, okay, so let's have a look at your tattoo.
I noticed in the hot summer last year that the red was starting to swell up a little bit, and it's then started being quite itchy. It's not sore or anything, but I do find when it's warm or when I've got out of the hot shower, it's really itchy, irritable.
So let's have a quick look at this. So I'm seeing that this raised reaction is only localized to the red ink, and nearly all of the red ink patches have become quite raised. Okay. So that, I think, is an allergic reaction to the red ink.
Red tattoo ink sometimes contains minute traces of metals such as mercury, which can cause itchiness and swelling.
The reaction that Lisa's having from a tattoo, is it a common problem?
This is a relatively common problem, and it only happens with the red ink.
Lisa's reaction appears mild, but it is possible it could get worse if left untreated.
Sometimes the itch can be so relentless, despite using the best steroid creams, it may still not go away, and then the patients end up getting excoriations or scratch marks on the skin and keep getting them infected.
If Lisa's reaction does get worse, what are her options?
We may give her some high-potency steroids, then injection of steroids into the skin. And sometimes even that doesn't help, in which case we need to remove the red ink. We can do that by laser treatment.
Fortunately for Lisa, Dr. Madan is satisfied she doesn't need laser treatment just yet. For now, he just wants her to keep an eye on it.
This is a small reaction. Fortunately, it's only about 5% of her tattoo altogether.
While Lisa's problem is unpleasant, it's thankfully nothing like as serious as some of the concerns raised in other media reports. I want to get Dr. Madan's take on some of them.
So, Dr. Madan, it can be a minefield, for people who are thinking about getting tattoos. First headline, contaminants from tattoo ink can end up in lymph nodes, study suggests. Now, I'm guessing lymph nodes, when people hear that, they think, that's serious. So, should we be scared of that headline?
Not necessarily. The lymph glands or lymph nodes are a normal phenomenon. We all have them, and the main function of the lymph nodes is to take away the contaminants, chemicals, and microorganisms away from the skin. So contaminants anywhere on the skin or anywhere in the body will eventually end up in lymph nodes anyways.
An essential part of the body's defense mechanism. Lymph nodes collect all sorts of harmful substances to clear them away from the body. That includes tattoo ink, but also bacteria.
So am I right in thinking then that we could lose tattoo ink, can't we, and still read that headline, contaminants can end up in lymph nodes?
Absolutely, yes.
So somebody then who hasn't got a tattoo, they could still find these contaminants in the lymph nodes?
Yes.
Next, the headline that really got us worried.
How concerned should we be about this? Tattoos being linked to cancer. This is very personal for me because my daughter's got tattoos, so from a personal point of view, I'm concerned, but obviously for everybody else as well who has tattoos.
I think it's an alarmist headline, purely and simply because there's no clinical research which points to tattoo inks causing cancer. Some inks may be carcinogenic, but again, there's no direct link between having tattoos and cancers.
Most mainstream tattoo inks contain tiny amounts of chemicals that have been linked to cancer. But no study has ever found any proof that having body art causes the disease to develop.
A positive headline, want to avoid a cold? Try a tattoo or 20, says the researcher there. But can it really help our immune system?
If you read the study, there is no link between having tattoos or having a cold. All they're saying is that a certain antibody would rise after having multiple tattoos, and there'll be a slight fall after having a single tattoo. That's just a lab-based research. It does not tell you anything about your immune system or whether having a tattoo or multiple will make you more susceptible to colds.
So, while there are carcinogenic particles in ink,